You're listening to Let's Talk AI.
Welcome to Let's Talk AI. I'm Harold Godwin. I'll be your host. Today's guest is Jeff Nagge. Jeff is the Clinical Associate Professor at the University of Waterloo School of Pharmacy. Welcome, Jeff.
Thanks, Harold. Thanks so much for the invitation.
It's so great to have you on board. I'd like to launch in initially to get us to tell us about your background. How did you come? What did you do before University of Waterloo? How did you get into this role? And then we'll go forward and talk about AI after that.
Sounds good. So I'm actually a local guy. So coming to the University of Waterloo is like coming home for me. I grew up in a little town called Maryhill, about 15 minutes outside of Kitchener-Waterloo. Did my undergraduate degree in science here at U of W. I should have asked you, Harold, if you're at U of W then, because I worked at Federation Hall back when it was a nightclub. And most people I mention that to, I've probably possibly throwing you out maybe once or twice. But so I went to Toronto then to do my undergraduate pharmacy degree. I completed a pharmacy residency then at the McMaster University Medical Center, and then went back and did my doctorate in pharmacy at the University of Toronto. I spent a couple years there practicing in acute care cardiology in Toronto General Hospital, and then that's when the exciting news that there was a school of pharmacy being developed at the University of Waterloo. So I believe I was the second, if not first, faculty member here at the University of Waterloo, and that was back in 2006. And before you know it, 20 years has passed, and here we are today.
Wow, that's and I won't acknowledge or deny if I'd ever been kicked out of Fed Hall. Okay, so great. So that's where you are. So tell us a little bit about the School of Pharmacy, and then we'll talk further. Like, what is it, and what's the whole goals and objectives, and then we'll talk about how is AI changing that world, like many others.
So the School of Pharmacy was our first class here at the University of Waterloo. It was in 2007, the first graduating class. I graduated in 2011. We've got 120 undergraduate students. It's a 4-year Doctor of Pharmacy program. So we currently about 480 undergrads at any given time at the school. And we have graduate programs both in the clinical sciences and then in more traditional grad school trainings, working with some wet lab researchers in drug development, discovery, and so forth. And we also have a residency program. So we, just like how I'd done in some training, so pharmacists who want to practice in more clinical settings than maybe in more of a traditional community pharmacy practice. We have some advanced clinical training opportunities where residents will spend a year with us in a family health team next door, providing various clinical services alongside family physicians and other healthcare professionals. So yeah, we're always just, although we're not located on main campus like most of the folks at the University of Waterloo, we're very similar in terms of always looking for ways that we can innovate the educational experience that we can offer our students, and that kind of leads us to how we've been using artificial intelligence at the School of Pharmacy.
Okay, great. So I met you just a couple of weeks back at one of our Waterloo AI events, and you presented on AI and pharmacy, and I'm like, wow, we got to get Jeff to tell us the story. So over to you. Tell us what's going on. How are you using AI, and how did this start, and where are you at now?
So the interesting thing is, so I've just been getting more interested in using artificial intelligence, I guess like everybody, because it's become more ubiquitous, I suppose. My original interests in research and training were in looking at novel ways for pharmacists to provide patient care services. So in particular, with my background in cardiology, one of the things that I was interested in is getting pharmacists doing more management of anticoagulation therapy. So anticoagulation therapy, up until a few years ago, consisted, if you were in the community and taking an anticoagulant drug, which some people hear the term anticoagulant and they call it a blood thinner. So maybe for simplicity's sake, let's call it a blood thinner. Essentially, it's used by individuals who have an increased risk of clotting. So that could be someone with an irregular heartbeat. It could be someone who's traveled on an airplane and they develop blood clots in their veins. Up until a few years ago, the most commonly used drug for that was something called warfarin or Coumadin. And again, people might know that as rat poison. It's actually a very similar chemical that's used in rat poison. It's really important that people who take warfarin have frequent blood tests, because the level of warfarin in your bloodstream is really important to maintain within a narrow range. If you have too much warfarin, it can lead to bleeding. If you don't have enough warfarin, it can lead to those clots that we were talking about. Now, traditionally, people who take warfarin are managed by their family doc. So their family physician will send the patients to a lab, they get a blood tested, and then the doctor will follow up a day or two later with instructions on how to manage the warfarin. There have been some technological advances in this area that allow pharmacists to do blood tests with just a little finger stick, kind of like a blood glucose machine. And that drop of blood can actually report how much warfarin is in someone's system. So, going into a pharmacy and having that blood test done and instructions on the spot with what to do with your warfarin certainly is an improvement over what's been done in traditionally with anticoagulants. But the big thing is this is a non-traditional role for pharmacists, right? So a lot of pharmacists wouldn't be used to providing this type of care. We don't necessarily teach to this level in our undergraduate curriculum. So I developed a continuing professional development program whereby pharmacists would learn about warfarin, how to use it, and then they'd come spend time with me in my anticoagulation clinic and learn about how to dose patients who are taking warfarin. It was fine for the first couple of years I did this CPD program because most of the people who took it were local, like within about an hour to Kitchener-Waterloo. But there were people across Canada who wanted to come and get this type of training. And as you can imagine, coming to spend 3 days in Kitchener isn't necessarily the most exciting option for some folks. I mean, I love the area, of course, but it might not be that exciting to some folks. So, and there are logistics with having to arrange time off work and so forth. So in 2018, we started thinking about what are some ways that we could replace that experiential training, that face-to-face learning that people would get in the clinic. And that's where we came up with a company and partnered with them to create a virtual anticoagulation clinic with artificially intelligent patients. And so what we did was we essentially created a customized interface for a chatbot. And the chatbot we used at the time back in 2018 was actually Watson IBM. So a very kind of a domain-specific version of artificial intelligence before the generative AI sort of came out. And so what we did was we created this clinic. We had 8 artificially intelligent patients that I developed based on the types of people that I saw in my clinic. And the learners would have to interact with them to gather information and then to decide what to do with their warfarin medication. More recently, we've upgraded, and so we don't use Watson IBM anymore. But we're actually using GPT-4, which provides a couple of advances in this. It makes it much more realistic because the language processing is so much stronger than it was with Watson IBM. And it provides me a lot more opportunity to provide more enhanced feedback to the learner as well. So it's been great. So we upgraded in 2023, and we've had some really good results with that upgrade to GPT-4. So that's currently where we're at now in terms of how we're integrating generative artificial intelligence into delivering experiential clinical training for pharmacists and for undergraduate pharmacy students.
Okay, so you talk about this training you've delivered. How many pharmacists have been trained thus far?
So we've trained since 2018 probably about 450 pharmacists, and we've trained about 60 undergraduate pharmacy students as part of an elective that we offer here too. So well over 500 people in total.
And this is all with the AI chatbots.
Yeah, that's right. So the first 10 years I offered the course, we were able to train about 250 people because I was limited by the number of clinic appointments I had and again travel arrangements and so forth. So from 250 over 10 years with the traditional way of doing it compared to we've done about over 500 now in the past 4 years. So that's kind of one of the biggest improvements I think of this process is that the scalability is essentially unlimited by how many learners I can take through this type of training.
Is there other such things like this happening in Canada, pharmaceutical training with chatbots, or is this a first in Canada or North America?
Yeah, no, it's a great question. It might actually be a first internationally. So I haven't been able to find anyone who's using it this way. So there's certainly been description about using GPT-4 as a tutor. So for example, like learners can go on and get it to assume the role of an expert anticoagulation advisor and quiz me on some of the things I should know about warfarin. I don't know of anyone who's using this though to deliver experiential clinical rotations, because essentially what I think makes this the most unique use of this is I'm really trying to recreate what that experience is for the learner, sitting beside the clinical expert with a patient in front of them. And that live face-to-face thing that, pharmacy training and medical training consists of, like when you think about medical residents, right? So much of their learning comes from the practical tips that they learn from their preceptor as they're seeing live patients. So that's really what I'm trying to recreate with these experiences. And to be honest with you, I'm not sure of anyone else who's using it in this particular way to deliver the experiential education. And in fact, we actually won a silver medal at the QS Reimagine Education Awards in Abu Dhabi in December of 2023 for it was a silver medal for the best use of generative AI in education. So I think that kind of highlights how this is quite novel actually on an international scale.
Wow. Well, first of all, congrats for all this, groundbreaking work. I always talk about, for people who are uncertain about AI and how it's coming on, I said, let's think of it as an enhancement to us as humans. And there you are giving some examples. So how has this affected the trainees and yourself as the trainor?
Great question. So first, from the trainees perspective, one of the things, maybe you might get, I'm a very enthusiastic person when it comes to things like this, and I love having learners with me in clinic. Like, there's nothing I enjoy more than teaching in a clinical setting. But one of the things that was troubled me was that, the learners who came to spend time with me in clinic would get 3 days with me. Now, I don't want to sound like I'm bragging, but our patients are generally pretty well managed. So when we get 60 people over 3 days in my clinic, most of them are pretty well in range. So we do the blood test, they're in range. It's like, hey, great, everything's good. We'll see you in a couple of weeks. So the learner doesn't necessarily learn much from when patients are in range. Whereas by creating this virtual clinic, I can structure what are the actual scenarios that the learner is going to encounter. So I can put in some very straightforward things, but I can also put in some more complex things that might happen rarely, but it's important that you know how to deal with it if it happens. So one is I can standardize the experience for everyone. I really think that's a big advantage. The other thing is when I reflect back to when I was a trainee, the reason why I'm this confident to provide anticoagulation services is because I had the good fortune of learning under my clinical mentor, Dr. Bill Bartle at Sunnybrook Hospital. He was essentially the pioneer for pharmacists doing this type of work in Canada, if not North America. If I was not located in Ontario and I didn't do my doctorate training at U of T, I would have never got a chance to work with him. Right? If I was in Saskatchewan, I would have no opportunity. So again, the other advantage to the learners are they can identify who the expert is and they can learn from that particular individual. So I think from those standpoints, those are two of the biggest things from the learners. I guess last thing I would say is we've done some research that demonstrates that learners who complete training in this virtual clinic have an increased confidence in their abilities in order to provide these types of services too. So I think that's really been great. From the instructor side, as I say, I really do miss having learners with me in clinic. I absolutely love it. I get a lot of energy from that. But I can accommodate so many more learners with this. So again, instead of me having to struggle to fit in 25 people a year, I've offered now, I can do 100 in 2 months, right? Like within a course. And so I get even more excited because there are more and more Canadians then who can access these specialized services because I can train more learners from that standpoint. And I alluded a little bit to the fact that the GPT-4 has improved both the realism of the scenarios to the learners because of the better language processing, but my assessment can be much more robust and include more detail as well. So I think, from my standpoint, I can deliver better feedback, more timely feedback, and more comprehensive feedback using this artificial intelligence than I could otherwise.
So closing the loop here, now they've been certified and they leave and go back to their home environments, as you said, all across Canada. Has there been feedback on success or improving on your training, or are they sharing stories with you? It's like, wow, that's exactly what happened from one of your things.
It's great you say it. I'll touch on the latter part of that first. So it's astonishing to me, perhaps. So again, I'll emphasize these are artificially intelligent, and I use air quotes, patients. Like they're chatbots, right? And I just create them with unique characteristics and so forth. But it's incredible how many learners who have graduated from the program will contact me a few months down the road and say, hey, you know what? I've been meaning to ask. Did he end up quitting smoking? Like, I know he was talking about it in the interaction with me, right? And I'm like, I don't almost have the heart to say Amadi doesn't exist, right? But so that there really is that. So I get a lot of feedback from that. We did get a research grant to study some of the feedback from learners in detail, and so we're in the process of looking at that now. But it's always a lot of effort when you're looking at spreadsheets worth of data to analyze for research purposes. But reading the feedback from the pharmacists was just incredible about how realistic these experiences were to them, and how effective they help solidify the online learning. So watching a lecture is one thing, but being able to apply that really helped them. So that's been really great. The kind of the thing that makes me the happiest perhaps about this is we do have some real world data that demonstrates the effectiveness of this. So this incorporating this experiential form of training using artificial intelligence has allowed us to train people across Canada. And so Nova Scotia is the province I wanted to highlight quickly. This the Pharmacists Association of Nova Scotia partnered with the government to have a pilot looking at pharmacists and the effectiveness of managing anticoagulant therapy, as opposed to, as I mentioned, the traditional model, which is family physicians. And so we were able to, all of the pharmacists who provide these anticoagulation services in Nova Scotia were trained in this anticoagulation training program through the University of Waterloo. And we've recently published a paper that demonstrated that the quality of warfarin-related care that these over 100 pharmacies in Nova Scotia and the 200 or so pharmacists associated with those pharmacies, the quality of warfarin-related care that they provided is the highest that's ever been reported in a primary care setting in Canada. So that's not all because of the anticoagulation training, but it certainly supports them in their ability to do this type of service. And again, it's invaluable. This is the type of thing that could possibly reduce the risk of major bleeding for patients or reduce the risk of stroke or other blood clots. So I'm really excited to say that it seems to be working.
Well, saving lives, that's what it's all about. So incredibly what you've achieved. Now, can this be applied to other areas? What could be the next area or two? And what is the future going to look like?
This is this is where I'm really getting excited about this. So anticoagulation is obviously a very niche area, and that, it's an area of passion for me. But when I think about what the opportunities are for this, I can't think of any type of clinical training in which experiential training is an important component, whereby it couldn't at least be supplemented. I'm not necessarily saying we replace traditional experiential learning, but we could certainly supplement it with something like this. So the first thing is obviously looking at developing these virtual clinics and other therapeutic topics. So I'm a cardiology guy, so my next clinic is going to be the hypertension clinic, because that's currently the type of clinic I run right now. But I'm working with colleagues who are Indigenous, and we're working on developing a module that will help pharmacists and other healthcare professionals become more comfortable in providing culturally competent care to Indigenous patients. So again, what a perfect way to do it, but by having it in a very safe environment where learners might feel nervous about phrasing things in a certain way. Well, this is a very safe way to practice and get feedback on how they're doing. I'm working with another group on helping train pharmacists to be vaccinators and offer things like vaccine clinics and so forth. So there are a variety of other therapeutic topic areas that we can move to. Just as a little bit of a teaser then, what I see in terms of research opportunities, I think everyone who's paying attention realizes that our healthcare system in Canada now is under remarkable strain, right? And it's kind of bursting at the seams in some ways. And if there's any way that we could maybe shorten the training time for healthcare professionals, that could be associated with significant advantages. If we can get a competently trained workforce into the workforce sooner, we can help maybe take some of the strain off the system. So one example that I'll give you is, using this anticoagulation training program, as I mentioned, we have a residency training program at the School of Pharmacy. So it used to be the pharmacy resident who came in every year. I would get them to do their anticoagulation training module as they started. So by the end of their 8-week rotation, they could manage that anticoagulation clinic independently. This is the first year that I actually got the resident to do this anticoagulation training program before she started. Well, lo and behold, she was actually running our anticoagulation clinic by her second day. So 7 weeks ahead of schedule. So this led me to think, what if we could create some other virtual clinical training modules, and again, hypertension, anticoagulation, diabetes, mental health. And if residents could take these training modules before they do their experiential training, maybe we can cut the experiential training in half. Because that's one of the things we're struggling with now across the country is getting people to do advanced clinical practice training, because you come out, from your undergraduate degree and you've got loads of mountains of debt, and you want me to pay me half the money to do this type of work? Well, so applications to residency programs are going down, but instead of maybe making them be a year long, what if we could shorten that down to 6 months? Maybe that increases the attractiveness to potential residents, and then, as I mentioned, maybe gets people out into the workforce faster.
Question for you about the training. There's asynchronous and synchronous training. Synchronous is live, one-on-one. They're all across Canada. Is this running as an asynchronous training module?
This is 100% asynchronous, so you can do it on your own time zone, which opens up the opportunity. And we've been thinking about, like, what about providing this to people in developing countries, right? So someone in Africa, and we've spoken to some partners in Africa who may be interested in some of this type of training. If they don't have access to this type of experiential training, this certainly would provide something better than nothing, if you will. So yeah, absolutely, it's completely asynchronous.
Do we have to go all the way so far? Can we just go south of the border, or just over the Atlantic to UK and things like that? Or is this going to conflict with their systems?
Absolutely not. This could be anywhere. The only thing that becomes a wrinkle for some potential therapeutic modules is that every country typically has their own guidelines for practice, right? So we typically try to structure our modules around the relevant guidelines in particular countries. But again, that's something that we could completely deal with. That's a minor challenge. Because right now, definitely, like this anticoagulation training module as an example, could be used anywhere in the world right now, and it would be appropriate.
This is very exciting. You've laid out the past, you've laid out the future. I'm just thinking here, how do more people going to find out about this? If they want, not necessarily just pharmacists, some of these other modules, would they reach out to you directly and say, hey, I want to do the hypertension with you?
Yeah, absolutely. So we're currently in the process of developing the other modules right now. So the only module we have available is the anticoagulation module. It takes anywhere from 3 to 4 months or so for development. So we're anticipating we should have at least 2 more modules, again, in the area of Indigenous care and in vaccine care, probably within the next 3 to 4 months or so. But if anyone is interested in finding out more about this or being a collaborator on any of these particular projects, please feel free to reach out to me. Again, my contact information is at the University of Waterloo School of Pharmacy website, and I'd be happy to chat with anyone about this.
Okay, this is great. Well, thanks very much for being a guest today on Let's Talk AI. This has been, I always learn the most talking directly to those who are making it happen. So thanks for being a guest today.
I really appreciate you having me, Harold. Thanks very much.